Hello, I'm Tor. Today I'm going to talk about healthcare in Norway compared to the United States. Healthcare in Norway is affordable, it's not free. Following the American debate, I found that progressives like Bernie Sanders are imprecise when they are describing the Norwegian healthcare system. It's painted with broad strokes, with statements that we have free healthcare in Norway. Not only are our healthcare not free, but you can even debate whether it's single payer. More on that later. According to the OECD, the United States are paying the highest percentage of GDP on healthcare with 17.2%, while the average in the industrialized world is 8.8%. Norway is at 10.4%, but the United States have worse results than many other countries. Life expectancy for males in the United States is only 76.1 year, below the OECD average at 78.1 year. In Norway, it's 80.7 years. If you're looking at infant mortality, 5.9 of 1,000 children dies before the age of 1 in the United States. That's significantly above the OECD average at 3.9. In Norway, the number is 2.2. Infant mortality and life expectancy are considered good metrics when you evaluate the quality of a nation's healthcare system. The main reasons for this disparity must be the growing inequality within the American society, where some people are receiving excellent care, while millions are uninsured or underinsured and are not getting the healthcare services that they need, or at a subpar quality. With this in mind, there's no wonder why progressives in America draws inspiration from the Nordic countries when they are looking for solutions to fix America's broken healthcare system. However, drawing the conclusion that our healthcare system is single payer and free is imprecise. In Norway, healthcare is only free for minors up to the age of 16 and for all maternity related issues. These groups will never pay a dime in the healthcare system. After the age of 16, you will be charged for consultations at your general practitioner. These are really deductibles as they do not represent the real cost of the consultation. The deductibles range from $18 to $36 at the general practitioner and between $30 to $40 at a specialist. However, you will almost always be required to see a general practitioner before being referred to a specialist in the public system. Prescription drugs are not free, but some are subsidized. However, if your accumulated bills exceed $275, there's a cap that makes sure you will pay no more deductibles for the rest of that calendar year. Hospital admissions will always be free of cost. Compared to the American healthcare system, you would agree that the Norwegian system is affordable but not free. The flip side of the public healthcare system we have in Norway is waiting lists. At my local hospital, the average waiting time is 59 days from referral to start of treatment. Many conditions receive treatments much faster than that, while other less problematic conditions might be postponed for several months. Waiting lists allows the hospitals to plan procedures and operations more efficiently. This requires less manpower than what you would need if all patients would receive immediate treatment. This reduces costs while maintaining a high quality of service. However, many people are frustrated by the long waiting lists and buy services in the private healthcare system. In Norway, this is kind of frowned upon and labeled as cutting the line. However, as the wealth in the population increases, this market grows. In the private systems, you would have to pay market price for those services, which means that prices are more aligned with what you find in the United States. You could also buy private health insurance, which ensures immediate treatment at private hospitals without the waiting lists. More and more companies buy these kinds of insurances on behalf of their employees to secure a speedy return to work after an illness or an injury. About 20% of all employees are now covered by some kind of private health insurance, and the number is rising. In conclusion, healthcare in Norway is overall excellent and affordable. However, it is not totally free, and the increase in private health insurance means that it's not really single payer anymore. This is true for other industrialized countries with similar systems as well. Should the United States try to implement a similar system? Yes, absolutely. If you could reduce your spending on healthcare down towards a Scandinavian level, you would save $1.5 trillion each year, according to my calculations, whilst achieving universal healthcare. Sounds like a sweet deal.